what is esophagogram? An esophagogram or barium swallow is the common radiographic procedure or examination of the pharynx and esophagus in which a radio-like contrast medium is used. The purpose of an esophagogram is to demonstrate radiographically the form and function of the pharynx and esophagus.
The fluoroscopic procedure room should be prepared before the patient is brought into the room. The examination room should be clean, tidy, and appropriately stocked before the patient is escorted to the room. The table is placed in the horizontal position and the fluoroscopic controls are set. A cotton or disposable sheet should be placed over the table. The appropriate barium or contrast media, feeding bottle, nipple straw, feeding catheter, and syringe should be ready for use. Suction and oxygen also should be readily available in the event of an emergency. Esophagograms generally use both thin and thick barium. As a radiographer, we need to make sure we choose the appropriate amount and type of contrast media for the patient. In esophagogram, we will choose a bigger cassette, which is 35 times 43 centimeters, since we need to cover a large area of our body part. Next, we need to center the tube and center the tube with the film or cassette. Put the right or left marker at the side of the film as long as it do not interfere with the region of interest. We need to choose the protocol to be used, which is the upper GI contrast in epi view, and select the adequate exposure factor that suits the patient. In this demonstration, we choose 80 kbp and 20 MAS for the patient. Because the esophagus is empty most of the time, patients need no preparation for an esophagogram unless an upper GI series is to follow. When combined with an upper GI, or if the primary interest is the lower esophagus, preparation for the UGI takes precedence, such as fasting. Before the fluoroscopic procedure is performed, a clinical history should be taken and the examination should be carefully explained to the patient, such as patient need to fast 8 hours before the procedure to prevent vomit, check the history of patient such as allergic, stop the medication given such as metformin, and then do the creatinine and bun level to check for kidney function to avoid contrast-induced nephropathy. Lead aprons, compression paddles, and lead gloves should be provided for the radiologist, as well as lead aprons for all other personnel in the room. Last but not least, make sure the patient sign the consent form.
So this is how we mix the barium and water for this procedure. Cik Faham kata everyone today. So what is your name? Your full name?
Farha binti Habibul Mutsidi.
Okay, can I know your last period?
Today is my first day of period.
Okay, so now we are going to do barium swallow procedure. So I need you to remove your clothes and remove all the metal objects near your body and change to the hospital gown.
Okay.
Now, we must explain the procedure to the patient. First, this procedure aims to visualize the esophagus, stomach, and intestine area. Patient need to drink the barium during the procedure, but first the patient need to hold the barium in the mouth until I ask the patient to swallow while expose the patient. The example indication for this procedure is GERD and heartburn. First, we must put the patient leg to ensure there is no rotation. Center the patient 7 cm distal to jugular notch or at T6. We will use horizontal beam for this procedure. And for SID is 100 cm. For the collimation, we must include starting from the upper mouth to the area of stomach. And for the lateral, we must include the skin margin. So now, ask the patient to drink the barium and ask her to hold in her mouth. Put the shielding at the reproductive area. Now, give instruction to the patient to drink the barium and start exposing. Okay, so now we are done. You can change to your procedure. For the post-procedure, first, we need to check the patient vital sign. Secondly, ask patient to drink enough water and ask patient to remain at department for 30 minutes. Also, we must notify the patient that there might be color changes in stool because of the barium.